and give you some information about what we're going to start talking about. We're going to work on seeing how we can introduce the TOR grantees and us who are going to be your partners. I want to introduce you to the National American Indian and Alaska Native ATTC, and also the goals for the TA opportunities, the strategic planning models, and then hopefully have some time for Q&A. Believe it or not, there are 135 tribal communities and organizations. And what in the interest of time, since we had a little bit of issues getting the right people and the right emails, I am a little concerned about following up on our goals to do a roll call. So what I am thinking is that it would be nice if you could send us an email with what organization you represent, so we are sure that we know exactly what organization and who you are. Usually we want to spend time introducing each other, but I'm not sure with the amount of people online that we are able to do that. However, here is what we are going to do. We are going to create a section on our web page where we will give you instructions about how to sign in, how to use our web page when you get technical assistance, and also for the opportunity to introduce yourself as well. So please just send us an email about what organization you represent. We have 3 teams working together. It's JBS International and Tarbell Facilitation Network and the National American Indian and Alaska Native ATTC. So these are your 3 partners. Here are some names. I have already introduced myself. My name is Anna-Helene Skinstad, and I'm Director of the National American Indian and Alaska Native ATTC. Sean Beer is our co-director. Kate Trams is a person you will be working with, who is conducting our webinar today, and Jeff Ledolter, who is going to manage the program for us. And Harold Tarbell is an expert on strategic planning and a member of the Mohawk Nation. And Pamela Peterson-Baston is representing JBS and is going to work very closely with you. So let me just take a few minutes to talk about the American Indian and Alaska Native Addiction Technology Transfer Center. We have been in operation since 2012, and we are refunded for another 5 years. We have worked, many of us, with tribal communities from 1998. And I was so pleased to hear and read that several of you are old friends, experienced colleagues, and I look forward to working with the ones I know and the ones I'm hopefully getting to know. The National American Indian and Alaska Native is a national center, but there are 10 regional ATTCs across the country. And what I'd like you to do is to look carefully where your state is located, in what region, and not hesitate to reach out to them and ask for assistance as well. Most of our regional ATTCs are focused on supporting people and agencies and populations that are working on solving the opiate issues across the country. We also actually have 4 international centers, and we have one national coordinating center. Our National American Indian and Alaska Native ATTC has 2 more centers, and one is called the Tribal Affairs Mental Health Technology Transfer Center, and the other one is called Prevention Technology Transfer Center. The one Tribal Affairs MHTTC is also very fortunate to have an additional opportunity to work with providers we haven't worked with before, and that is staff and counselors in schools, and prepare them for how to handle traumas happening in the school environment, and how to make students more able to cope with the trauma, and also the faculty. Now I'm not sure what's happening, Kate. I lost my... Okay. Bear with us a little. So here is some of the things that we will continue to talk about and spend more time on the rest of this session. And I wanted to highlight that you guys are very, very active and interested in making a very good job and contributing to your tribal communities, because we have had questions from the get-go. One was concerning position descriptions, the other one was interview guide, and what we will do is, as soon as we've done with this center, this presentation, we will be creating the web page section and also upload some of these files so we can so you can all have access to those files. And now I'd like to hand the presentation over to Pam Baston from JBS International, who will go through the goals and major requirements for this grant. So Pam, are you ready? Can you unmute yourself? Okay. Let's see what we can do. Kate, can you help? Okay. Are you ready, Pam?
Still shows that I'm muted.
Now we can hear you.
Okay, now you can hear me. Thank you.
Yes.
Yeah, I could not unmute myself. It had to be done by y'all. Well, hi everybody. My name is Pam Peterson Baston, and I'm with JBS International. And I have a couple other folks from JBS, Erica Jordy and also Roxana Galdamez, who are also on the call. You'll be hearing our names and emails and things over the course of this 2-year period, and it's our honor to be here with you. Will somebody else be turning the slides forward?
I can do that.
And I can walk you through.
I can do that.
Okay, great. Okay, so you may know that Umberto Carvalho, I don't know how to pronounce his last name well, Carvalho, he is our public health advisor with SAMHSA for the American Indian Native Alaskan Addiction Technology Transfer Center. And so it is this individual that is over the technical assistance delivery to the TOR grantees. Now, you all have your own government project officers, and they might also be called public health advisors. There's 2 different names we see being used. And so your own project officers are who you will need to respond to if you've got questions about your budget or questions about your requirements and things of that nature. The purpose of our technical assistance and the role that we will play with you is offering you support to help you implement your grant award. So we're not there to answer, you know, the questions around your budget and your rules and your deadlines, really. We're there to help you with everything else that you need to meet those deadlines. Next. So as you might remember, it wasn't that long ago that you wrote the grant application. The goal of this opioid response grant is to address the opioid crisis in tribal communities really in 2 ways. One is to increase access to culturally appropriate and evidence-based treatment, including medication-assisted treatment, using one of the 3 Food and Drug Administration approved medications. You may know those as methadone, buprenorphine, which comes in 2 different formats, Subutex and Suboxone, and then also Vivitrol or naloxone products. Also, to reduce the unmet need, the unmet treatment need, and opioid overdose-related deaths through the provision of prevention, treatment, and/or recovery activities for opioid use disorder. Now, I want to pause here and mention that if you go to the SAMHSA website and you click on the Grants tab, you can go find the actual application announcement that you wrote and responded to, and over to the far right it will say, you know, to click on here to see the grantees. I know somebody's already asked this question, that if you go to the SAMHSA website, go to the grants, and then click on your grant announcement where it says TOR, to the right, you can see all the grantees that were funded under this initiative. And you will see that there is a significant difference in the amount of funds awarded. Some grantees got $50,000, some got $100,000, some got a couple hundred or more, depending on a number of factors, including the size of the tribe and what was requested in the grant announcement. And so one of the things that we are acutely aware of is that for some of your smaller awards, there will be obviously a limit to the amount of things that you can accomplish. You know, $50,000 will buy a person or a part-time person to work in this initiative, or several part-time people. So when we walk you through these goals and we walk you through the activities and the requirements, we are aware that some of you will be able to do a lot more based on your budgets than others, and that all of this you will work out with your own government project officer about, you know, what you are able to accomplish and what you said you would be able to do in your grant application. Okay, next. So one of the requirements is that you develop a strategic plan, and that plan has to be based on a needs assessment. And so you have to look at the data and the information that you are aware of in your tribal community and use that information to identify the gaps, that you would like to fill to do opioid prevention, treatment, and recovery, and also what resources you might already have in your community that you can use or leverage or build upon so that you can improve and expand and enhance your prevention, treatment, and or community-based recovery support. We've put the page numbers. The word FOA is for your funding opportunity announcement. We used to call these RFPs, but it's the document that you use to write your grant. And if you go back to that on page 5, that is where that information is provided. And then you have to complete this comprehensive strategic plan based on these data to address the gaps, and you are allowed to use existing plans if you already have one that speaks to opioid use disorder. So if you have a plan that says what you need to do in your tribal community to address the opioid use disorder, prevention, treatment, and recovery, then you may use it. And if not, then you have to complete this plan. And it has to be done. You can turn the next slide, please. It has to be done within 60 days of your grant award, which they consider to be the September 30th was the day the clock started ticking on your 60 days. And you have until it has to be turned in to your public health advisor or government project officer, whichever title they use, that you've been assigned to, and that is who you will turn in your strategic plan to. And we are asking for a copy to be sent to us as well, and we will provide that link in a few minutes. Now, you know, at the risk of scaring you off, I know that strategic planning sounds like it's a very long, involved process, and it can be. But what we have done is worked with some of the folks at SAMHSA to arrange for them to accept an abbreviated version of a strategic plan. We're calling it, Harold came up with this name, which we love, the rapid strategic planning process. And what we have created is a template that we will make available to you that can be fairly easily filled out to meet this requirement in this very abbreviated time frame that you have of now, I don't know, 45 days or so left. And so we're showing you a picture. It's kind of hard to see here, but what we've done is we've taken every requirement in your grant. We've pasted it in this light blue area. When you see the light blue shaded area, that speaks to one of the grant requirements that you have to complete over this 2-year period of funding. And so we say to you, you know, like, and I'm trying to see if I can read this, it says, grantees are required to implement the activities below on which your plan will focus. And for each item that you see in this little blue ribbon, and you'll see one on every page, you're then taking that information and creating objectives and activities and assigning a responsible person or persons and a target date. So I'm going to make up an example here just to show you what this could be. So let's say that one of your objectives is to identify all the individuals in your tribal community or beyond, if there's others that you work with, that have played some role in the opioid crisis. And let's say you say, you know, we got this funding, we need to figure out who to partner with or who is already out there doing something, and we would like to figure out who all those players are so that we can create a comprehensive response and that we don't duplicate something that might already be available. So maybe your objective would be, you know, by 30 days from now or 2 weeks from now, identify the collaborative partners that play a role currently in opioid prevention, treatment, or recovery support. So maybe that's your objective. Then you would go over to the activities and you would say, well, what do we have to do in order to find out who all those collaborative partners are? You know, somebody needs to reach out to the first responders who show up on the scene of overdoses. Maybe that's an activity and you assign that to John, and somebody else you want to send them to the hospital to find out what do they do when someone comes into the emergency room in an overdose condition. And so you assign that to Harold. And so you go down and you take each objective and you just write out what activities you would need to do. And put a name and a date that you would like to get those activities met. And you would just continue through these several pages, and we're only showing you one here, but we'll make this whole template available. So I guess what we're trying to say here is we're trying to make this as simple and straightforward as possible given this very short time frame you have. We are also going to be hosting some webinars that we will announce very soon, probably in the next several days, that you can attend, and we can help you figure out how to fill these things out if you need greater assistance. So we are here to help make this as easy and painless as possible. I do want to note that if you look down in your chat box, Erica Jordy from JBS International has sent you the link that you can click on to be able to see who your fellow grant awards are. Okay, next. So that was the sample template. We talked about these upcoming webinars. We also are going to talk in a little bit about a meeting that we are holding in Minnesota. We'll talk about that. It's going to be in December. But at that meeting, which is optional, anyone who has submitted their strategic plan, but perhaps they're not happy with it, or maybe they took it as far as they could within the time frame, but they really would like to spend a little more time completing it or making it, taking it to the next level, we will have, in addition to lots of other fabulous technical assistance on medication-assisted treatment and all kinds of, discussions around how to, also implement culturally relevant traditional practices, that address opioid use disorder. And so we expect to have some panel discussions, and other tribes that have made some progress in this area share their ideas. And so that meeting, which we'll talk about soon, will also have this breakout session for anyone who would like to come to get additional help with their strategic plan. This will be after your due date. So your due date is November 29th, but at least if you turn something in, that meets the deadline, you'll have an opportunity to improve upon it at this meeting. And we're going to have Harold talk a little bit more. Harold Tarbell has some more involved strategic planning, more in-depth models that he will talk about, and especially this will be relevant for either larger tribes or tribes that got more significant funding awards that maybe want to embark in a more involved, in-depth, comprehensive strategic planning process. Next. So grantees, this is one of the other requirements, evidence-based approaches. You will develop and provide opioid misuse prevention, treatment, and recovery support to address the opioid crisis within the tribes, and that however you decide how much of each of these you're going to do, how much prevention, how much treatment, how much recovery support, and what that looks like will be very much tied to what you identify in your plan as being needed. Also, and this comes straight out of the RFA or out of the funding opportunity announcement, page 6. So I'm just reading this to you, that these funds require that evidence-based treatment practices and interventions for opioid use disorder be used by grantees and sub-grantees, and that you have to use the Food and Drug Administration medication-assisted treatment and to individuals who are actually diagnosed with opioid use disorder. And then the various types of medications that are considered Food and Drug Administration approved are listed here. I mentioned these earlier. And as you can see, some of them come in tablets. Some are films that look like a little piece of tape that you put under your tongue that melts. Some are injections like shots. Some are products that can be implanted under your skin, like some of the birth control devices that look like little matchsticks that go in your arm. So there's various versions of this. And again, this is what was in the grant announcement that you applied to. Next. In addition to these treatment services, grantees are required to employ effective prevention and recovery support services to ensure that there's this comprehensive array. Again, if you're getting $50,000, that array is going to look a little different than if you have more money to work with or greater resources in your community. SAMHSA will be looking at monitoring these awards to make sure that you are using evidence-based and experience-based treatment and recovery supports because they are not wanting their funds to support non-evidence-based approaches. Page 6. Next. Now, one of the things you might have noticed at the very beginning of the application is that a component, it mentions at the top on page 5 that a component of the Tribal Behavioral Health Agenda, and I'm quite sure most of you have seen this agenda. If not, if you even just Google those words, you will go to a phenomenal resource. That also will give you some really good ideas about goals and objectives and activities, not specific to opioid, but you can see how well their plan is written. But also, you are a part of that, they call it an agenda, but it's really like a plan, is the American Indian and Alaska Native Cultural Wisdom Declaration, CWD, which elevates the importance of tribal identities, culture, spiritual beliefs, and practices for improving well-being. This grant announcement supports CWD and the inclusion of traditional practices in the grant application. So I want to stop there and say, you know, you will have to work with your government project officers because they're the ones that, you know, monitor these rules and these requirements. We're just reminding you what they are. But what it appears is that you will have an opportunity to integrate or to collaboratively implement the evidence-based medications that SAMHSA has asked you to select at least one with some of the traditional practices that you might have already been using or that you are aware are being used in other tribal communities to successfully prevent or treat opioid use disorder. And so how you work that combination out is between you and your project officer. I mentioned that SAMHSA will monitor the use of these funds to make sure that they are being implemented consistent with the grant award. And then also the services that you are expected to implement have to be implemented by the 4th month after the grant has been awarded. And this is documented in the grant application that you wrote to on page 6. Now we inquire, what does the 4th month mean? Because we know that's in January. Does that mean any time in that month? You know, what does it mean? And it says that, and we were told that they meant by the 1st day of the month. So unless you work something else out with your project officer, we read this as your some service delivery has to be up and running by the 1st of January. I know that's coming very quickly, and that is why we also offered and got permission to hold this technical assistance meeting so that we can be there, again in December, to give you as much support as possible. And in a few minutes, we'll ask you to think about and let us know, you know, what else you might need in the way of technical assistance to meet these fast approaching deadlines. You know, we know that you write a grant announcement, you write a proposal. There was not a lot of time to put these proposals together. I think you all had 2 weeks or less. And so now sort of the rubber's hitting the road where, you know, congratulations, you got a funding award, and now, you know, the deadlines are fast approaching. So we want to be there to help in any way that we can so that everybody can succeed in these deadlines and with these requirements. Next. So also around evidence-based, this is a definition that you can find in the grant announcement. I won't go through all of this, but basically that the evidence-based practices have been ones that have been validated, that there's some research evidence or some documentation from either researchers or the practitioners that demonstrate that these practices are effective. And so that's one of the criteria. If you select something to do that you would like to spend your funds on, then your project officer will say, well, how did you know that that's effective? How did you pick that practice for prevention, treatment, or recovery support, and what evidence do you have that it will work? And so I guess that's all we really need to say. There's a link there at the bottom of this slide, and it's found on your page 10 of your funding opportunity announcement that you responded to, and it gives you a link to different evidence-based practices if you want to see some additional ones that you might not be aware of. And that's at the very bottom of the slide there, the www.drugabuse.gov then I think it has a slash, but you can link to it directly from the application itself that you wrote your grant to. Next. Webinars and other technical assistance. We do have the upcoming face-to-face TA meeting that Anna Helene will tell you about. And we are also hoping to provide, like I said, some assistance around medication-assisted treatment and opioid misuse prevention. Some people, when they hear opioid misuse prevention, and if you ever Google that, you'll end up finding a lot of overdose prevention. And so we are aware that while most of what is considered opioid misuse prevention tends to focus pretty far downstream on the person that is overdosing, you know, and so there's different activities that are implemented, such as just to give you an example, one is making sure that individuals who are opioid users, whether they use heroin or whether they use prescription opioids, either prescriptions that they get from a legitimate prescriber, or whether they're getting, you know, alleged prescriptions off the street that are ones that can be being made in people's garages using pill presses and, you know, all this other very dangerous forms that can include fentanyl, which even a couple little granules, almost like salt granules, can kill a person. And so these individuals that are using opioids need to have Narcan, which is the medication that will reverse an opioid overdose and bring that person, you know, back from the brink of death. There are a lot of programs that not only put that within the reach of individuals who are users of opioids, but also their family members, so that if the person overdoses, their family members know how to revive them so they can get them the help that they need to not have to rely on this substance. There are also some interesting things happening where individuals are coroners that have identified individuals who have died from opioid overdose, send letters to the doctors and the prescribers of any person who passed away from the legitimate prescription of opioids that they were given for pain. And there's been a reduction, a proven reduction in deaths from individuals who, when the prescribers saw that a lot of their patients were dying, they realized maybe they were prescribing too freely or too much opioid, or the dose is too high or too frequent, and they start, you know, looking at that a little better, and that there is then less deaths to those prescribers who got those letters from the coroner. So these are just, there's many others, and we'll provide lots of technical assistance on what are all the different things you can do for opioid misuse prevention. And we know you have ideas that you've put in your grant applications that you will also be implementing. Next. Grantees who currently receive opioid-related funding from other programs are supposed to coordinate those activities to eliminate duplication of services. So if any of you are getting other opioid-related funding from, let's say, the Centers for Disease Control or other SAMHSA grants, or you know, maybe from HRSA or from the Administration of Children and Families or Bureau of Justice Assistance, any federal funding that you might already get for opioids, you're supposed to make sure you coordinate whatever you're doing with this money, the TOR money, to make sure you're not duplicating or supplanting any services, and that these are all coordinated. And you'll want to mention that in your strategic plan if you get multiple funding streams. And I do want to say we are aware that approximately, depending on what statistic you look at, 90% of all opioid users use other substances as well. And we're also very aware that many of you, particularly out west, have a huge meth problem, which it might be bigger than opioid. And so you might be doing more prevention to keep that from coming to your community if you don't already have it. And then also we will talk to you at the meeting in December about speedballing, which is the combination of stimulants like methamphetamine with opioids that are being used together. So there's lots of things that people can do that even are heavy in communities and tribes that are have lots of meth and other substance use going on. Next. We're down to just the last couple slides for me, and then I'll be handing it off to Harold. Just a reminder that in your grant notice and in the application itself, that your project director has to be approved by SAMHSA, by your project officer, or your public health advisor, whatever their title is, so that you will have to send that person's resume or their information, their bio, something. You know, you'll have to ask your project officer what it is that they would like to get from you before you can hire this person, and that we want you to know that we had already been receiving requests for technical assistance on, you know, what should I look for in a project director? And that's the only person anybody that you identified as key personnel, and in the application it only names the project director. And that's whether or not this person is receiving a salary or money from the project. If they play a role, a key role, and they're like a project director in your grant, you have to get permission from your project officer to employ them or to have them work on the project. But we got some requests about, you know, what should we look for in such a person? And so we created a sample job description for you. We also created sample questions that you might ask someone in a job interview. And both of those documents we will make available to you. They're already completed. But I just want you to know that they map exactly to the funding announcement. So you may want to add other things in that speak exactly to your tribe's needs. We just mapped it back to the duties of this grant. And you can take it, you can leave it, you can use it, you can throw it away, you can take what you like and throw away the rest. It's just there as an optional. You know, we try to anticipate anything you might need and get ready to make it available to you for your consideration. Next. And I want to say that the Tribal Health Agenda link was already placed on your chat box. Those of you that have not seen that amazing document, it is well worth your read, and you'll see it highlighted in blue, a hyperlink there in the chat box. Lastly, these are the tools that I just spoke about. To the left is the job description that we created for you as a sample, again, that you can edit freely. It's in a Word document. You can do whatever you want with it. And to the right is a set of project director interview questions. And we created this with a scale of 1 to 3. So we're only showing you, because it's one little slide, just the top part of what is a 3 or 4, I think, page document. And so the interview questions are to the left. So you would ask the candidate, you know, describe the experience that you have with, you know, whatever the item is. And you would say to them, would you rate yourself 1, that you have really solid experience of 3 years or more? Would you have some experience, not a lot, but some of 1 to 2 years, or would you have no experience? And however they answer, you could put a check in those boxes. And so that you get a sense of, you know, an at-a-glance sense of how strong that candidate is in the various areas along the left. And there's room for you to put some comments you know, that might clarify some of your responses. And you can add any questions you want, or you can, like I said, do whatever you want with it. It's just there for your use in editing. Next. Oh, I forgot one last thing. You do have data collection and performance requirements. These are ones that we will not be getting involved with really from technical assistance, because for every person that receives treatment, you have to collect this GPRA data, Government Performance and Results, GPRA data. And there's various points you have to enter the data directly into, you know, the website. SAMHSA provides the TA for that. We will not be doing that under this contract, under your TA contract, but there's plenty of help for that. They're very patient. If you've not done this before, they'll work with you till you figure it out. So we will, you know, recommend that you work with your public health advisor or your government project officer. Again, what title? I think they have different titles. And get help as you might need it for your data collection and performance measurement. Next. Funding, financial considerations. I think this is my last slide. I keep saying that. Grantees must use funding to supplement and not supplant. So you can add new services and supports and prevention to what you're already doing. But if you already have something going on that's been funded a different way, you can't move that money out and move this money in. Now, if you had something going on that ends and it was going to close then and go away, then using these funds to keep that going would not be considered supplanting if it was ending. Again, as long as it's opioid prevention, treatment, or recovery support, as long as it aligns with what you said you would do in your grant application and with the application, you know, the funding opportunity announcement, and your government project officer agrees, you know, that that is all workable. So any questions that you have related to the financing, budgets, any of that goes to the other folks, these government project officers to which you're assigned or to whom you're assigned. We will probably be providing some cool technical assistance on grant writing and sustainability, either at the meeting coming up in December or through webinars or other ways or multiple ways. But in terms of your exact budget questions, those need to go to your government project officer. And I hope I'm ready to hand this off to you, Harold. Let's see, next. Yay, okay. So it was great chatting with you. I'll be around in case you have any questions afterwards. And Harold, take it away.
However, I'm wondering if there are questions that people would like to ask Pam before Harold starts.
Whatever suits you. It's a lot to think about. I know we're going through a lot of information, and we know you were probably aware of all of that when you were writing your grant application, but like I said, that was, you know, a few months ago, and seems like a lifetime ago, but now we're, oh, okay, so there is a question, where can we find the templates that you discussed? So, Anna Helene, I know you are planning to set up a dedicated website. Is that, how can they get these templates? I mean, we can email them as well if it.
What we're going to do is to dedicate one part of our webpage for this project only. And we will upload those templates to this part of the site. And I think we will later in the PowerPoint give you that link to our website. Because we have had some issues with maxing out on the number of people who could have access to the Adobe Connect PowerPoint, we will also provide the PowerPoint slide deck for everybody to see, and the oral presentation as well. All this will go in to this specific section of the web page.
Okay. And then there was a question about whether naloxone or Narcan, the overdose reversal medication, can be purchased with these grant funds. And I am looking that up now. If it's not directly stated, I believe it is possible because I know it was in the other version of this funding. But and at JBS, we work with the state opioid response grantees through their evaluation. So, and I'm providing some TA on this in Florida right now. So I'm now crosswalking this application with what the other one was to see if you're allowed to do that. If not, you're going to have to check with your project officer because we don't, as a TA provider, get into what you can fund, you know, what you're allowed to spend your funds on unless it's expressly stated. So it says on page 6 that you are to use these funds for, and it mentions the different opioid use disorder medications, and it says it does include buprenorphine products, naloxone tablets, films, injectable buprenorphine implants, okay, and injectable extended release naltrexone. So oh, I see what it is. Okay, it's the buprenorphine naloxone tablets. So they're talking there about the 2 different versions of buprenorphine. So let me see here if you can do naloxone with overdose reversal, which, you know, it comes in the nasal spray. It says that you are allowed to develop effective, on page 7, develop effective prevention strategies that include but are not limited to elder education, outreach and engagement of youth, strategic messaging, and community prevention activities. You can develop strategies to purchase and disseminate naloxone and provide training on its use to first responders and other tribal members. So according to page 7, it appears that you are able to purchase and disseminate naloxone. Now again, you'll have to work with your project officer about how much of your grant award will you dedicate to this, and also know that within some states you can get that free through some of the funds that were given to the states, the $1 billion that went out over 2 years. So it does appear that you can do that. Also, I did want to mention that some communities are leaving extra naloxone, nasal sprays with the family members of current overdose victims, because there's a significant number of people who overdose. If they overdose once, they're likely to overdose again, so they leave them as a preventive method. I might have already mentioned that. But yes, it looks like you can, to answer your question, use some grant funds. You just have to work with your government project officer on how much you dedicate to that, and to make sure that it isn't available. These funds are always considered the funds of last resort, meaning that if something like that is already available free, or for example, if there's medication-assisted treatment that you are going to purchase with these funds, but it's readily available in your community at no cost, then your job might be to get people to those medications rather than spend funds of your own on them if they're already readily available. Now, if there's a shortage or there's a waiting list or something like that, then obviously you would want to use your funds accordingly. Question, where do we find the project officer info? So now, where to find the project officer? Now, I believe in your, I know there are 3 officers that we are aware of. Amy Romero is a name that you might want to write down and look within your notice of funding availability and see if her name appears, or there's a gentleman who's, there's 2 other people actually, and one of them is Ramon Bonzon, B-O-N-Z-O-N, Ramon Bonzon. Both of those individuals we've worked with before and know them well, and they're great project officers. The third person I'm sure is as well. I don't remember, Anna Helene, do you remember the third project officer's name? Because you'll want to see if you've got any emails from these individuals or if their name appears in your Notice of Funding Award. Erica, if you happen to know.
Here is what I suggest. We have an overview of all the grantees with their respective program officers. So I think that spreadsheet is something we will be uploading on our webpage. That way you can go and look for your specific tribal community and find who your program officer is.
Okay, that sounds like a good solution. Okay, a few other questions here. Okay, let's see. Courtney West apparently is a GPO too, so that's another name. But like Anna Helene said, you should be able to get the information from what we will post to you. I did see one last question. How do we find how do we change our project director? I don't think that was what the person meant. I'm not really sure what that means, how to change our project director, meaning you might have already hired one without getting permission from SAMHSA. If that's what you meant, then you would contact them and just say you weren't aware or you didn't remember it was in your RFA and what do they want you to do, and maybe they can approve the person after the fact or work with you on how to address that. Any other questions? So Harold, after a lengthy time here, it is now time to walk them through some strategic planning. And he might be muted, I can't tell. Oh no, he's not. Or Harold, your phone might be muted. On the computer, it doesn't have a mute by your name, but your personal phone might be muted because we can't hear you. Anna Helene, Kate?
Hi, this is Kate. I'm having some connectivity issues at my house, so I can't see.
1, 2, 3.
I can't see if. Is that you, Harold?
Yep. Test 1, 2, 3.
Yes, we can hear you now.
Harold,
perfect.
Unmute yourself.
Yep, I was hearing you there, Harold. I don't.
Am I okay now?
Yes.
Can the attendees hear me? All right, thank you, Jesse,
Yes.
and Sandra and Daniel. Got it. Thank you very much for that. All right, so let me pick up on the slides that are there. And essentially, I'm going to abbreviate this a little bit. We'll leave some of the slides here for you for reference. But essentially, in the interest of time, we're going to kind of work through this fairly quickly and then open up for questions. The first two slides that you see here, this one and this one here, essentially are providing you with some relatively straightforward definitions and what it is and what it isn't, and then some lessons learned. And just to sort of say this should be a good tool and a process for you to use to help you sort of say, this is where we want to go, this is what we want to accomplish, here's where we are, and based upon that, here's the areas we'll focus on, here's the adjustments we would make in order to give us the best possible chance of getting there over and then strategic planning generally over a period longer than a year. I'll try to, if I had to sort of try to put it in more layman's language, what strategic planning tries to do, it helps you to unravel sort of a complex environment. It helps you to figure out how to better align and coordinate across the project or across your business lines or across the organization. And then it helps you to, in that sense, to give a little bit more strategic analysis and strategic management to it, which is a step different than project management, which is A to B to C to D. I would just say one other lesson I would note here as we go through this is that you really do want to focus on a manageable number of strategic priorities. And in the models I'm going to show you, Balanced Scorecard likes to focus on 3 or 4 themes. 3 is really their ideal. I'm sort of in the area of about 5, and then I see other models that talk about 7 or 8, but essentially you want to keep it a manageable amount. So, for example, if it's treatment, prevention, and recovery, those are fairly, good areas to think about in terms of bundling. And you'll see in some of the other models how they manage some of the other consideration. In the situation that you're in, the grant uses some pretty straightforward strategic planning language, I think, really given the federal context around the GIPRA. But it has a strong heads up in the language to you about focusing on certain things, identifying needs and gaps, assessing your capacity, and then focusing on some key results in treatment primarily, then prevention and recovery within the scope of your, I would say within the scope of your approved funding. And then slide 30, which is just down here, sets out the basic steps of a strategic planning process. All right, so you'll do all of these in a way, but you'll be doing them in a fairly abbreviated, or what we've taken to calling the rapid strategic planning process. Much of the content that you're seeing being asked for here is already available in some respects, I think, in your grant proposal, in your contribution agreement, and some of your other work plans, and some of your reports and publications and other places. And what we'll talk about here is some tools and technique which will make it relatively easy to develop some of the things that you may not have that you see listed across the board here. The grant does refer to the ability to use your existing strategic plans, whether that's within your department or within your organization, within your tribe or within your Alaska Native village, wherever that is. And it's really about sort of finding a way to make the connection. And the line I always use in strategic planning is when you're looking at those, it's quite possible to have multiple strategic plans, but you want to make sure that they are aligned and they're each feeding into each other, and they're not working at cross purposes. So, and then I always try to say, you're looking at the broader strategic plan relative to this particular project and thinking, how am I informed by what I see in the overall strategic plan of my group, organization, tribe, etc. And then how can I adjust and organize my work so that I am contributing in some way, shape, or form to some or all of the strategic plan. And generally, when you're looking at a broader organizational strategic plan or a tribal strategic plan, it's not likely that this small grant will connect to every piece, but it's pretty likely it'll connect to some piece there, whether it's healthy communities or healthy families or vibrant families and communities. However that's reflected in your plan itself. I'm going to touch on a few of these as we go through, but essentially there's some work that you can do to get organized for the process, and that will feed into the rapid strategic template that Pam's talked to. I would note that there is, you look at the writing the strategic plan, so there's a real range, and that range is really reflective of how much time, effort, and resources you're going to put into the plan. And so here I think we're really focusing on the lower number of pages in this, primarily in the strategic planning template, work plan template we've got for you, and then some narrative to shape it out. Just as a bit of a story from the field, the smallest strategic plan I've ever seen was actually placed on 3 business cards, essentially something that was 3 business cards stapled, connected together. So it was a mini brochure. It was a bit of a gimmick, but it did really focus on sort of those high level things and sort of the future direction the organization was trying to move in. So it was very eye catching, and it really made it an impact. So volume necessarily does not always help being strategic and seeing the through line through all of the work that you see there. I'll go to slide one, next one here. So what you've got here is this is an example of a strategic work plan that I've drawn from a strategic plan that was done with a Canadian First Nations tribal council or band council. I think in here you'll see the resemblance between that and the sample that Pam showed you earlier. It's consistent with other strategic plans and work plans that you're be familiar with. I would just point out here that, to make the distinction between the goal of the strategy there, what you're trying to achieve, to accomplish, the outcomes in terms of what change will be created and what's the impact of that change, and then the outputs at the bottom, which are the things that will be produced. So just to, as you look at being strategic, there's the 2 levels of that sort of inputs, products, or inputs, process, outputs, outcomes. So the other thing I would say is let's not try to. I would recommend against quibbling about the difference between an objective and a goal, or an objective and a task, or a strategy and a tactic. And essentially, what you're after is you really just want to make sure the logic is sound and that they feed into each other in a nice, orderly way. And so that's the logic of the process. The reason I make that urging is I've been in a lot of sessions where we've argued a lot about the distinctions and never really came to any agreement on it, and as a result also never developed any. So just to be cautious given the limits that you're working under. What we've got here is the Grove strategic visioning model, and these are a couple of graphic templates, PowerPoint slides and flip chart sizes, and all shapes and sizes that you can use to help you work through the process. The process there is essentially the same 7 process I laid out before, but it just sort of shows you that at a certain part in this process, it's not going to feel so linear, and there is some intuition and some judgment that has to go into that. This also tries to give you that feel for you are looking back to the past for some lessons learned, you're figuring out where you are at the moment, and you're figuring out how to move to the future, and that's sort of what you're going to see here. And that theme comes up several times in strategic planning. So history, context map, SWOT analysis or SWOT analysis, these are the organizational profile and environmental scanning steps. And then here, these 2, I would say, I like to use them because they're kind of a strategic plan in a nutshell. So on the left, on the 5 bold steps, you have the vision, you have the mission, you have the values. On the left and the right, you have sort of some of the environmental scanning, support, and challenges. And then for the bold steps, I always like to say, what are your core strategic priorities? And then in terms of the game plan on the left, so essentially this is, if you look at it, similar to that sample I showed, similar to the strategic template that Pam showed, and similar to work plans that you've worked on. It's just a little bit more interactive and more engaging, and very much supportive of encouraging some creative thinking in the process. By the way, just on this issue here, so the only other sort of lesson learned I would say about this history and the environmental scanning, the trends, political, economic, social, demographic, technological, legal, and your SWOT analysis. What are my current internal strengths and weaknesses? What are my potential external future-oriented opportunities and threats? The what I would really urge is that just don't stop there, because really the key part of the strategic planning is so what? So what I looked at my history, so what I looked at what's in and around me, so what I looked at the organization and our things. What does that, it's really what does that mean and how does that inform the critical strategic issues, your selection of priorities and your selection of strategies. And just one example. So if you're trying to deal with something and you find that in your SWOT analysis, it's in this area here of problems and threats, you really want to be conscientious about it. Sometimes you have to do it as a protective factor because your survival depends on it. But really where you want to be focusing is on those things that are aligning your strengths with opportunities. So that's, from an analysis point of view, straightforward analysis, that's something you're trying to do with these forms. And the last model I'll show you is the balanced scorecard model. And on this one, I am certified on this particular model. And but this one really emphasizes the focus on objectives and that it's a bit of a value chain that you design from the top down. So you're doing mission, vision, values, strategic themes, the results you're after. And then you're really getting into sort of the objectives, the strategic map and the objectives there. You're working on your measures and then your targets. And then you're figuring out strategic initiatives so that if you follow the logic back, if I pursue this strategic initiative, this will help me to achieve this target I'm trying to get to. Here's what I'm measuring it on. And then this feeds into achieving the objectives. The other thing I would say about the balanced scorecard model is there's always 4 perspectives that come out in strategic planning, and they come out in lots of different shapes and sizes. And strategic plans, when you look at them, come out in all kinds of shapes and sizes. So I think you have some flexibility there as well. My view is make the model work for you, not bend yourself into a pretzel to fit into the model. Although many of the proponents of these models, like the Grove and the balanced scorecard, they're more of, oh, no, you must do A, B, C, D, E, F, G in order for it to be effective. The last thing I'll say about these perspectives on the left, so you'll see organizational capacity, process, customer, and finance. So these are recurring strategic perspectives. So what's the professional development, knowledge, skills, awareness that you need in your organization itself? What are the internal business process improvements that you need to be making or adjustments? How are you addressing customer needs and engagement and satisfaction? And then how are you managing your resources effectively and efficiently? One distinction I would make is that this model you're seeing in front of you is from more the profit corporate side, and then when you're looking at it from our not-for-profit or from a government side, generally they try to change the order of those two, and that's what that little arrow means in the slide there. That means that in a not-for-profit or a government sector, customer engagement and satisfaction is of a higher priority than financial stewardship. They're not that less important, it's just that in terms of the emphasis that is given in the process, right? So just think of the needs of our tribes and organizations and villages to be responsive to its stakeholders, to our people. The other dynamic I find in strategic planning is it's very difficult for us as Indigenous people to think of our community members as external to our organization. So that's always a little nuance we've got to deal with here. And then slide 38, which is the last slide I'll show you on strategic planning, is an example of a balanced scorecard summary for a government not-for-profit management system, on the government side. And if you look at the strategic perspectives, they are adjusted, right? So organizational capacity, these are the objectives we're going to work on. If we do that, we're contributing to achieving these objectives in the internal business processes. If we achieve that, we are contributing either to financial stewardship or we're contributing to client, customer, community satisfaction. And then all of those feed together to help to reduce, in this case, child poverty. So just, showing again, the value chain and the logic model of this organization. And then here you'll see their strategic results that they're after. And in some ways you could quibble about, is that the strategic goal for this strategic theme? But again, my urging is not to quibble about those kind of terminology. Just make sure that you have the ones you need there. So they've got the three themes that they like to focus on, their mission, and then their vision statement. So again, in a nutshell, that's the plan, and then you could see how the strategic template could fit behind that. I think just for a quick introduction to strategic planning, I'll leave it there, and we're coming up on 12:15, so leave some time for anything from the attendees or from our hosts.
Thank you very, very much, Harold. This was a wonderful run through, but for some it may be quite overwhelming. So before I do my final slides, what I'm wondering about is kind of your first questions to Harold.
Yeah, and as people are typing those in, it was noted earlier, we'll do some technical assistance.
Yeah, I'm going to go over that towards the end now, but I know that this can, especially if we look at the last slide here, look very, very overwhelming.
Yeah,
but I assure you that we're going to do a lot of hand-holding.
Yeah, and all I would say is, again, this is just to show a couple different models. Yeah, balanced scorecard is, can be pretty intense. But the other versions, growth, strategic planning, and then the more generic process, again, those are more where we're leaning to. Particularly given the limited time and resources that most of the grantees have. Limited time that all the grantees have and limited resources.
Yeah.
I'm not seeing any questions coming in, so.
Okay.
We'll take that as a good sign.
Yes. Thank you very much, Harold. And I will just skip to my last slides and closing suggestions. We have decided we are going to provide 8 conference calls from now on to the end of November, because that's when the deadline is for your strategic plan. What I want to say is that we have preliminary set a TA meeting in Mystic Lake, Minnesota. It's voluntary, and we're hoping to get it on 13, 14, and 15th of December. However, because we need to make very quick decisions about room block, etc., I need you all who would like to participate to send us how many and who will be participating from your organization, so we can find a room and place for this. I'm hoping we can get it in to Mystic Lake. For those of you who have been to Mystic Lake, it is a 45-minute drive outside of the airport in Minneapolis, and it's a very nice tribal property. But please indicate to us who will want to participate so we can make final decisions about the contract. After the November 30th deadline is up, and we've had our TA meeting, We're going to go to monthly conference calls from then on. And those were more focused on the implementation of what you decided to do, whereas between now and the end of November would be a push for the strategic planning webinar series. And I know Harold will go through a lot of what he quickly ran through just now and go into details for you. So even though it may sound overwhelming, Harold will walk us through this very nicely. However, what I also want to say is that fortunately, right off the bat, we had questions from some of you about things you really needed from us. And we really encourage you to send us your other TA needs. You may need something else to succeed. And we want to make sure we try as hard as we can to give you all the support that you need. So please send us your TA needs. But how can we collaborate together? And one way of making it possible for us to be as supportive and constructive with you all is to have you think about sending us your grant proposal. I'm not now thinking about your budget and that kind of thing, but the content of your grant proposal, because our team will go through your proposal and help you figure out how to reach your goals. And the more we know, the better we are able to provide that kind of TA. Because we will then understand what your strengths are and what your challenges may be, and be able to guide you with the strengths and the challenges. So please consider this so we can help you as much as we can. And we will soon announce the web page for you, because since we had some technical issues with people not being able to sign in because we had maxed out, we want to make sure that you have access to the slide deck, to this presentation, and also to all the templates that we have developed. What I also want to say is that we have provided you with guidance on position descriptions and interview guides. That doesn't mean you do not have the opportunity to culturally adapt this, because I know that some of you may use other ways of interviewing and also assessing a person's capability in your community. So these are all guiding that you can use in whichever way you feel comfortable. And finally, Pam went over this cult. I can't even get the acronym correct, Pam, but the importance of thinking about what kind of cultural practices that you have used already, and find ways of adapting what Western medicine might give us as opportunity to treat opiate addiction, and combine it with traditional practices, which is what a lot of you, I'm sure, will want to do. So even though there is a very strong commitment towards Western-based medication-assisted treatments, that doesn't mean that the experience-based approaches aren't important. So we have gotten a lot of emails concerning new names and also new email addresses, and we will go over to make sure that you have access to these files that we are going to be able to provide you with. I see there is a question about funding to travel to Minneapolis. We do not have funding for that. It is voluntary, and you may have to find funding somewhere else. I do not, because I don't think that that was part of your grant proposal. So this is really up to you. And we are also not able to provide support for travel and lodging, but we will provide support for conference rooms and breakout sessions and all that kind of thing. And people asked about shuttles. If you start working with us on coming to that meeting, there are shuttles, and we have worked with Mystic Lake Casino many times, so there are opportunities to organize for shuttle. There will be no registration fee for you. I'm hoping I am answering all the questions we are getting. I'm delighted that you asked all the questions for clarification.
Yeah, this is Sean Bearcall, ours speaking right now. Yeah, one thing about the culture and with evidence-based practices. So with SAMHSA, they have a large list of evidence-based practices. There's also a separate section that is with evidence-based practices for American Indians and Alaskan Natives. So that list is much smaller, because looking at evidence-based practices, many of these evidence-based practices were studied with non-natives. But with the ones that are under the list with American Indians and Alaskan Natives, those are actually those that have been kind of placed under evidence-based practices because there's evidence that it has been working. A lot of times what we do is to help speak at that level so that they would understand the culture is very different when it comes to the population of the different tribes, as well as all the Native Americans or Alaskan Natives as a whole. So sometimes those things do come out.
I'm wondering if there are any more questions and suggestions. We have a little bit more time left, and on our end, we will be having a lot of catch up to do, providing you with the templates and with the information that we have promised you, and we will find ways to get this information to you very soon. What you can also expect is that for those of you who are not used to GIPRA forms, we are going to send you GIPRA forms to complete after this meeting. So there's a lot of things that will come your way, and don't hesitate to follow up and asking us what you need, and we will provide you with whatever we promised today.
And it's Harold. I noticed one of the questions was who do they send their plans to? And perhaps the clarification is, are they talking about their strategic plans or are they talking about their grant proposals? And do those go to different places? And then who is the person that they will get it at JBS in terms of their grant proposals?
A very good question. I think that the strategic plan eventually will go to your program officer, but here is something we can check out. I think you all had to upload your grant proposal to ER Commons, and you may have to upload that strategic plan there too, but we promise to check that out. When it comes to the grant proposal, let me go back here. Here is the person in JBS International that you will send the content of your grant proposal. And since we're going to provide you with this slide deck, you will have this email address in your PowerPoint presentation that we will send. Thank you, Harold.
Mm-hmm.
We have a question from Kelly asking, is this TA meeting hosted by the ATTC and JBS? And yes, the answer is yes. It is not hosted by SAMHSA. However, what I'd like you to know is that in our proposal, we specifically asked if we could have a face-to-face meeting with you all, because we know that that is a very effective way of networking, of communicating, and also collaborating, and it is culturally more preferred than all the electronic things that we do. So it is hosted by the ATTC in collaboration with JBS and Harold Tarbell. And Roxana made a clarification that JBS is interested and we are interested in the program narrative, not every addendum and all that, because we don't need that. We are getting close to the end of our meeting. Is there anything else we should do at the end? And we have one here that's a very interesting one. We have not checked out whether the TA meeting in Minneapolis can be available over Skype or Zoom. We will do that when we start going back to the people we're working with at Mystic Lake. Thank you very much for asking, because that would be an important part of our negotiations with the hotel and casino. I can take one more question, and then I think we will do a lot of the conference calls and the webinars before November, the end of November, as conference calls, webinars, Adobe Connect, whatever. That's our preferred method, and we will expand the lines so we don't have the same issue as we had today. But I don't know if Cassandra, you were thinking that the meeting was going to be available over teleconference also, and I'm not sure about that. That's one of those things we need to negotiate with Mystic Lake. Okay, thank you very much all. It's been a very, very productive meeting. I'm still very sorry we had some technical issues in the beginning. I can guarantee you we'll take care of that, and we will get that section of the web page up very quickly so that all the templates, the audio of this presentation, and also the schedule for the upcoming conference calls will be available for you very quickly. So thank you very much, and we all look very much forward to working with you.